Staying atop the latest breaking news issues and trends in all things neurology is exactly what Neurology Today does, the official news source of the AAN. Editor-in-Chief Dr. Joseph Safdieh sits down in studio with us now to discuss overseeing all the latest information and then making sure that it gets out to the masses. Such a pleasure to have you here today.
Thanks for having me.
Well, of course, let's get started with right now what you are seeing as far as the best advances in neurology.
So I would say it's been the year of therapies, therapies, therapies. We're getting so many new therapies for disorders, some of which have had no therapies before that were effective, some of which had partially effective therapies. So we're seeing in areas like neuromyelitis optica, new therapies that are really, really effective. We're seeing it in areas like epilepsy, MS, stroke, neuromuscular disorders, and we are on top of that covering all those treatment advances that neurologists can implement into their practices. That's definitely been the highlight of the last year or two.
As you just mentioned, by listing those off, there's constantly something new coming along, and I would imagine it's a little bit tedious to try and stay atop all the latest breaking information. How do you do that and make sure that you're not missing something pertinent?
Great question. We focus on a number of different strategies for that. The main thing is our editorial board. We have a wonderful editorial board of many leaders in the AAN, many people who have content expertise, and we make sure to balance the editorial board with people from different perspectives from all of the subspecialties. And we ask them all the time, what's happening in your field? What's happening that people are talking about that isn't in the journals yet? What do we need to be understanding in terms of trends that's moving forward? Because we want to catch those early. We want to look at those areas and have neurologists get a sense of what's coming out, what's exciting, to get the feedback, to make sure people are aware and are on the cutting edge.
And you also mentioned a little bit earlier that you're different from a journal in the sense that you can provide in the newspaper a little tidbit of what's to come. You can do so to keep yourselves up to speed.
Yeah, exactly. So the nice thing about us being a newspaper is we don't have to go through the peer review process formally. We don't accept commissioned articles. We actually publish based on a number of things that are happening out there. We are looking at trends. We're looking at what's happening at the bench. We're looking at what's happening in clinical practice. We're telling stories not only about neurology, but about neurologists. And we're doing original reporting. In a recent issue, we did something on, what does it mean that things like board certifying exams like the USMLE exams for medical students are becoming pass-fail? How does that impact medical schools, residency application, US News and World Report rankings? A lot of medical schools pulled out. What does that mean? So we're not only talking about clinical topics that of course are really important, we're also talking about areas that might impact the field of neurology as a whole.
So very all-encompassing.
Correct.
All right. Like you mentioned earlier, you're a print publication here every other week. Do you feel that there's still an appetite for a print publication? I mean, people are so digital these days.
Yeah, I agree completely with that. So I believe very strongly that the information should be available for people in whatever way that they see fit for them. So we certainly have the print. Many people tell me, oh, you are certainly the most important thing that I read, which makes me feel great. They take it with them on airplanes, they take it with them into their offices, they do read it. But if somebody reads it online, if somebody reads it through our social media posts, it's perfectly fine. I actually like to think of us not as a publication, but as a source of information. And I want us to be a brand. Neurology Today should be a brand that people trust for information that's accurate, that's timely, and that they need to know to take better care of their patients and also to have a better sense of what's happening in the field.
And before I let you go, you actually have a third way to consume the information, which is your podcast.
Yes.
Can you tell us briefly about Neurology Today in 5?
Yes, what I do in my podcast is that I look at each issue and I pick 3 articles, usually from different sections. I usually pick something for patient care, something that's more in the pipeline, and something that might be about professionalism or practice. And I just do a quick summary. So I describe the highlights of the article and then a little bit about what our experts are saying. And I do that in 5 minutes or less. So every other week for 5 minutes, you can get the highlights of Neurology Today just by listening, maybe on your short commute or just in a few minutes that you have free between patients.
Wonderful. Well, Dr. Joseph Safdieh, we certainly appreciate your time today. And we should point out you can pick up a copy of Neurology Today right here in the Convention Center before you head home this afternoon. Thanks for your time.
Thank you so much for having me.